This video will review preoperative instructions prior to shoulder replacement. In terms of diet instructions, 14 days prior to surgery, you should stop any herbal supplements to include echinacea, ginseng, ginkgo, garlic, valerian, St. John's wort, ephedra, turmeric, and fish oil. 8 days prior to surgery, you should stop any anti-inflammatory medications such as ibuprofen, Motrin, Advil, naproxen, or Aleve. If you take low-dose aspirin, you may continue this. The day before surgery, you should hydrate well with electrolyte fluid such as Powerade Zero or Gatorade, and eat foods that are rich in complex carbohydrates and avoid heavy fatty foods. Do not eat any solid food after midnight. In terms of preoperative medications, if you take any immunosuppressive medications at the direction of a rheumatologist or other physicians, please check with them about how long before and after to hold these medications. If you take blood thinners, it is very important to let the surgical team know so that a plan can be developed around holding these before surgery. Xarelto, Eliquis, Pradaxa, Pleatal should all be stopped about 3 days prior to surgery. Coumadin should be stopped 5 days prior to surgery, and Plavix and Brilinta should be stopped 7 days prior to surgery. If you fail to stop taking blood thinners at the appropriate time, your surgery may have to be canceled and rescheduled due to the risk of bleeding. On preoperative bathing instructions, you will be provided with a bottle of Hibiclens antibacterial soap at your preoperative visit. Start washing with this 5 days prior to surgery in the following manner. Wash your hair and face first with regular shampoo and soap and rinse thoroughly. Move away from the water stream. Apply Hibiclens over your body, excluding your face, and wait 3 minutes. Rinse thoroughly and do not use regular soap afterwards. Use a clean towel to dry off, and do not apply lotions or creams after use. You may shower the morning of surgery. We also recommend that shoulder replacement patients purchase a bottle of Panoxyl from the pharmacy. This contains benzoyl peroxide, which helps reduce the concentration of Cutibacterium acnes on the skin around the shoulder. After you wash with Hibiclens, wash just your shoulder area and armpit with Panoxyl starting 5 days before surgery. Apply to the area and let sit for 5 minutes prior to rinsing off. If your nasal swab was positive for staph bacteria, you will be prescribed mupirocin, which is an antibiotic ointment. Use a cotton tip swab to apply a small amount to each nostril twice daily for 5 days prior to surgery. On the day of surgery, you can drink clear liquids up to 3 hours before your procedure. Do not eat any solid food on the day of your surgery. Allowed liquids include water, apple or cranberry juice, Gatorade or Powerade, black coffee or tea, clear broth, ginger ale, seltzer, and Jell-O. Liquids that are not allowed include milk or any dairy products, including in your coffee or tea, citrus juices, prune juice, any juice with pulp, and anything not listed on the allowed list. Start Tylenol Extra Strength 2 pills every 8 hours 3 days prior to your surgery. Do not take this the morning of surgery. The last dose should be the night before. If you do not have diabetes, you will also be given a prescription for Decadron to take the night before surgery. You may take any other regular medications except for blood thinners and NSAIDs.